This government meeting is brought to you by Eastworks and our local cable subscribers.
Hi, everybody.
Hi.
Everyone, I don't think we have a quorum yet, so we will need
Yep.
to hold on for a moment. Pat Ruff did text me and said he would be a few minutes late. I expect Chuck and Louise. I believe we need 5 for a quorum.
Okay, Chuck's here. So we just need one more.
Yeah, Pat or Louise. Louise is typically a couple of minutes late.
Okay.
Cindy?
Yes.
Hi. I've got a real quick question.
Yeah.
Is Pat Wojcicki is no longer a member of the board? Is this the case?
Not to my knowledge.
Okay, which means she's still a member of the board?
As far as I know.
Okay. Because I shouldn't say we, but I haven't seen her at quite a few of the, previous meetings. And so that's why I asked.
Yeah, and Joe, you and I had exchanged a conversation briefly about that. I'm not even sure how to contact her or who has contact information for her to, I guess, basically just check in with her. It's kind of odd that she hasn't been to a meeting. This is probably the 3rd one, at least.
Mm-hmm.
Could someone, because I'm busily admitting people, could someone else please look at Louise's minutes and see who was in attendance at the last meeting? We do have some people from the Friends, somebody's here from the Friends group, either Mary or David, but that doesn't give us a quorum yet because they're not members.
Was according to the Louise's minutes from last time, it said that Patricia was present at the meeting. I don't remember her being there.
Me neither.
Okay,
let me check my notes.
We can also look back at the recording from last time. Yeah, because Barbara did ask for an update. City clerk. Okay, Tom, so what do we do? It's 11:03.
We hang in there for Pat or Louise. I believe they would be there.
And before we are recording, everybody knows that. So before we have a quorum, can we do any introductions or talk about the agenda?
Yes, I would say yes on introductions, no on the agenda.
Okay, so let's go around and do introductions. I'll start. Cynthia Terrell, director, have been here since mid-October. You want to go next, Stan?
Yes, Stan Diamond. I've been a board member back when Brendan was the director and still am.
Great. Thank you, Stan. Joe?
I'm Joe Banis. I'm a member of the board. I was just appointed for my 2nd term starting in January. So I've been here a bit over 3 years.
Congratulations. All right, Crystal, you're next on my screen. Hi.
Hi, I'm Crystal Cotestos. I was just nominated by the mayor and city council, so this is my first meeting. I don't know if it's official yet or not, but here I am.
Yay, congratulations.
Welcome.
Thanks, Crystal.
Welcome.
Could somebody comment on how we know that becomes official?
It's my understanding. Well, it would be approved by the city council
Appointments committee.
Appointments committee. That's correct. I assume, Crystal, that you were involved with them a little bit to do like an interview kind of thing. I think it's because after that's approved, Cindy, it goes back to the full board, which I don't want to say is kind of a rubber stamp, but it's kind of a rubber stamp at that point. And typically in the past, we've said you're official when you get your letter from the mayor.
Okay.
Okay. All right, Tom, why don't you go ahead and introduce yourself?
Tom Brown, I'm currently chair of the board. I guess that's the title. President, maybe, I don't know. I joined this group in 1986. I'm not sure we had email then, never mind Zoom. But I was just, like Joe, I was just reappointed, I think, for my 11th term, maybe. So, and ironically, when I was appointed as the sort of a youth representative. I was 32 years old at the time, and now I'm 42.
Pat and Louise, we're just going around doing introductions, and now we have a quorum. So let's just continue with introductions. Chuck?
I am Chuck Connor. I've been a board member for a year and a half or 2 years. I lost track. Local business owner.
Thank you so much. And Louise, you want to introduce yourself?
Yeah. Hi, Louise Jacob. I'm a new resident here. Actually, I've had it up 4 years now, but also that's been called it.
Could everybody mute yourselves? And since Louise froze, we might need to hide our video, but we shouldn't need to.
She might have jumped off, Cindy, and signed back in by the looks of it.
Okay, Louise, you want to continue now that you're back in?
Can you hear us, Louise?
Now I can.
Okay.
That was, anyway, hi. Yeah.
Cindy, you're muted.
Thank you. Pat, you want to introduce yourself?
Sure, I am Pat Ruff. I work at Finken Paris Insurance Agency. I've been on the board for, I gotta think it's 3 years. I do remember actually having in-person meetings, so it's been at least 3 years because we haven't had one of those for a long time. And I do a bunch of different things around the city, so thank you.
Thank you. Thank you so much for your service. All right, and I see we have Mary Morris here. Are you here for the public speak portion, Mary?
Actually, no, I was just here to attend the meeting and see what was going on, kind of being nosy.
Okay, do you want to just introduce yourself and say who you are?
I am Mary Morris. I am the new treasurer of the Friends. My husband and I moved here it's a year ago today.
Okay.
We moved to Easthampton. And he is the vice president of the Friends. He's not available right now. But as I say, I just wanted to see who the board members were and just kind of get a lay of the land.
Okay, thank you so much, Mary. Thank you for all you do. Tom?
And I think we overlooked Crystal for introductions. Did we, Chris? Maybe you did, Crystal, but you want to just give us a little bit of your background?
So I was previously the executive director of the Lathrop Home residential care home in Northampton. Now I work as the executive director for Christopher Heights Assisted Living in Northampton. I was also previously employed as the assistant director for Northampton Senior Services. And I worked with Cindy when we did the benefit counseling grant through Mass Council on Aging in Northampton. So I have quite a bit of experience working for the municipality in Northampton as well as in the private sector for senior services.
Great, thank you. It's great to have folks on the board that are still working, like you and Chuck and Pat, so that you guys can keep paying into Social Security so the rest of us can stay retired. And Chuck, and not to give Chuck a plug, I know Pat mentioned he's with Fink and Paris. Chuck is the principal at Taylor Real Estate here in Easthampton, still very actively involved, has to work for a living. So with that, we'll call the meeting to order and look for approval of the minutes of our last meeting. Thank you, Louise, for preparing the minutes. You should have all received a copy of them. Are there any?
I'll make a
go ahead, Pat.
I'll make a motion to accept the minutes.
Okay. Joe? You're muted, Joe.
That's where I'm going. I'd second that, except for the fact that the minutes from the last meeting mentioned Pat Wojcicki as having been present at the meeting. I don't have any recollection that she was present. Does anyone else have any, or if we want to just check on that before we approve the minutes?
Yeah, I don't believe she was there. I agree with you, Joe. And we've been a little concerned because we haven't seen Pat at least for 3 meetings or so. And unfortunately, I apologize, I don't have any contact information for her to reach out just to check on her.
I do have her email address from, previous meetings. So at some point, probably after the meeting, I can just shoot her an email and ask her whether she's still participating or what her status is.
That would be great, Joe.
Okay.
And Louise, could we amend the minutes to take out Pat's name? Because I'm pretty confident we're all believe he was not there. So minutes have been, a motion was made and seconded to approve the minutes with that one correction. Are there any other additions or deletions to the minutes? Hearing none, all in favor? Mr. Williams?
Aye.
Opposed? Thank you very much. Public speak. Anyone? I see JP's looking to get in, Cindy. We can ask him if there's anything he'd like to say. Otherwise, he's not going to be able to talk.
He's here. He's just muted right now.
JP, we're right at the time of public speak. I don't know if there's anything you wanted to say to the group or if you were just listening in. Your choice.
I think he's still connecting.
Okay, we're going to move on to the financial report. Cindy?
Okay. Nothing new since last time. Last time you got basically what's I would say is a full quarterly report. We discussed recent deposits that hadn't made it in yet. And the only thing new on the fiscal front is that we're meeting with the treasurer this week and the auditor to discuss what's our current state of affairs. Could we move funds from staffing line item to line item in the hopes of getting some more staffing, especially at reception and dispatch this year temporarily until we hopefully can put through, hopefully we will put through and get approved additional staffing for FY23. So that conversation is happening this Wednesday. I think after that conversation, I'll have more of a sense of what will the actual budget for FY22 look like compared to the projected budget for FY22, because I'll know if we will be moving any funds or if at the end of the year, those funds in the director line item from the leadership transition would end up in free cash. But that's all I have to say today.
Okay, great. Any questions for Cindy? Everything else, Cindy, is we're on target for where we are financially? Expenditures?
Yes, I would just add one thing, which is that because I haven't been able to do a deep dive on transportation and how it looks to date compared to the projection, what I've done is instruct the staff that let's minimize, if not eliminate, days when we need 3 drivers, because having a 3rd driver on was a last ditch way some days to serve everybody who had called. But because we have 1 driver down due to quarantine, we're already practicing what it's like to only have 2 part-time drivers. And I think budgetarily, we may have to do that. So if it turns out we don't need to do that, once I do that deep dive into the numbers, I'll be letting our staff know that. But also for a future date, we should talk more about transportation and how it's going in terms of the fiscal implications and how we have it organized. So I might be asking the board for a little committee about the fiscal issues to do with transportation to help me look at that.
Okay, great. Thank you.
Yep.
Pat, anything to report from Highland Valley?
I just wanted to mention, I was just grabbing my notes here from our meeting last week. They are seeing kind of the same challenges that everyone else is seeing. There's a few members of the COA that are on that committee as well, and just hearing the same struggles that I'm sure Cindy's going to tell us as well. So it's everywhere. They're having the same struggles with COVID just in general, as far as getting out to see people, their employees, the same kind of concerns that are, widespread throughout the country. But other than that, nothing major to report from there.
Okay, thanks, Pat.
Yep.
Cindy, you're up.
So let's see. I'm not looking at my agenda screen right now. Are we on new business? I'm sorry, old business.
Yeah, old business.
Old business. Okay. Here's the update from the COVID front. I know some of you especially are very interested in vaccination, what we're doing around vaccination. We haven't talked much here about masks, specifically kinds of masks. I can give you a little update on that. So we're in new territory right now in regard to so we have very high vaccination rate in Easthampton for the older population. We don't know how many are boosted. So we don't know how many people could use better vaccination. We just put out a new COVID policy to the public stating that we expect people to be, quote, up to date, end quote, on their vaccinations, and we refer them to the CDC for more information. As opposed to saying, if you've had 2 shots of a 2-shot series, get a booster. We say, if you're eligible, we encourage you to get a booster. Some say that we could possibly change that to say specifically what we are requiring, and that somehow we could check people's vaccinations to make sure that they are up to date. And that could be a moving target as the months go on in terms of what is considered up to date. So what I have done is the best I think I can right now by using that up-to-date language, running it by the city's attorneys, and at the same time, in order to keep our drivers and passengers safe in particular as possible, we're looking into, since the city epidemiologist Megan suggested, that I don't know if she's saying we're past the point of encouraging boosters and that we should be requiring them. That's an area of exploration, put it that way. So I'm trying to be on the leading edge in terms of what we can require to keep everyone as safe as possible. In terms of the center, and when we fully reopen, can we require vaccinations? That's a continuing conversation. In regard to masking, we have some older KN95 masks that we're trying to give out as fast as possible before they expire in April. I don't think they're the highest quality KN95s, but we have them. And for people who can't buy masks, we're trying to give them out as fast as possible. In regard to COVID, in regard to will we require better masks? I just learned today that we can require, as a Council on Aging, masks of a quality over and above what the city requires in its masking ordinance, or what the city requires of employees. Do we want to do that? Do we want to tell, especially riders who are in a confined space with the driver, that they have to wear a better mask than they have on and present them with better masks? We've already encouraged that. Do we want to require it? I can make a policy like that at the COA level. Just not sure if we should yet. So that's under consideration. And COVID tests, rapid tests. We got rapid test kits. The city had to buy test kits. It was not given free ones like some other municipalities. We have very limited number left, and we are to give them out fairly and impartially. We've made up bags with special instructions for the test kits and masks, and we're giving them out to people that actively use the center or call us to use the center. We've given them out at meals. We've given them out at outreach appointments. It's not worth advertising them to the public, say in our newsletter, because there are so few, but we do want to get them out to everyone during the surge. So anybody watching this meeting or wanting to spread this out by word of mouth can certainly do so. And we're also suggesting it as much as we can without actually advertising it in our policies and on our website. I would say that's what's happening on the COVID front right now. And we have to track those test kits because only a household can only get one once in this round. So that's actually a significant piece of work to try to, in this way, distribute and track them, especially with the doors locked. Otherwise, we're doing okay. We haven't had a breakout here. We've had a couple of cases among the staff, which have not spread from person to person here. Does anybody have any questions about COVID precautions, distribution of resources? Let me know.
Cindy, one question about the masks and riders, transportation. If we did institute a policy of requiring a better quality mask, would we have that mask available when the rider was picked up, or would they have to be refused the ride at that point?
Right now, we have enough masks for that purpose. And the city just ordered more KF94 masks, which is almost the same level. They don't fit everyone, but I'm going to see how many of those we can get. Those arrive today. So if I can be assured that every day I have, say, I think 10 masks on hand to give out to the riders, maybe 20, I think we'll be in good shape, especially if I give them the instructions I wrote up so that they can actually take care of them correctly and not wash them with water or wear them after they get dirty. So it's possible, but let's say, what if it wasn't possible? What if we were out of high quality masks? We have plenty of surgical masks that we can give out, and we do. They're not very good quality. So then the final thing would be, should the COA buy masks? So I did talk with the fire department about if they're putting in an order of, say, N95 masks for their EMTs and so on, could we get in on that order? And they kindly just brought us a bunch of N95s, and that's what we offered to the drivers and to the outreach workers in their meeting with clients. But we don't have enough for the public. So should we should we make a policy like this and divert part of our budget to buying masks? I guess is that the implication of what you're asking, Tom?
No, I think the implication was more about, I don't want to create a policy that's going to throw people off the bus, so to speak.
Yeah.
And I mean, everything I've heard, CDC related, mask related, starts at the bottom line, which is some kind of mask is better than no mask.
That's right.
And then as you get masks, as you get more sophisticated masks, you get better protection. But I think we've come a long way in at least getting people to wear a mask. I'd be a little reluctant saying, especially if the driver is the poor person that has to enforce this, I'm sorry, you're and what's going to be the flavor of the day for masks next week. And I'm not trying to be sarcastic about it, but it does change pretty regularly. So, I'm sorry, you have a KN95 and this week it's KN96. So, I think if they have a mask on, we've come a long way. Frankly, I'm not sure this outbreak we're seeing in Easthampton right now is related to, I mean, obviously it's highly transmissible and can affect everybody, but I'm not seeing it out there among seniors right now. I'm seeing it more in my own family. It's everybody who's around kids in school is where it's coming from right now. So and again, I'm not trying to discount it, but I think if folks are wearing a mask, I think that's good enough. That's my personal opinion.
JP, what did you have to say? Because I see your hands up before I go.
Hi. I just was curious about masks. I know that in schools, they were last week or the week before sent out masks, and they were a non-medical version, which gave about 40 or 45% efficiency rather than 95% efficiency. I didn't know if these had been checked with the ones that you received, and that if police people would know that if they're getting the KN95s that are really KN95s or a subversion of the 95 of the KN95 that's really 40% effective and maybe equal to a regular cloth mask. And as Tom had said, better some mask than no mask, but didn't want there to be anyone who was getting something they thought was really protective and wasn't. So that was just a quick question.
Yeah.
Cindy?
Yeah, I can say I actually talked with a friend about this who manages COVID policy at a local institution or manages COVID coordination. And I talked about that. I said, these KN95s we have, they don't have a brand name on them. And they also have the word protective on the bag. And those are two, I think, keys that they're clues that they were made early in the pandemic, and they might be not the best, similar to what JP is talking about. And they could even be the same mask. And she said, we have the same issue at our institution. We're giving out all these masks. People could complain that they're not the perfect mask. But the point is that we need people to be masked, and not everybody is going to buy all their own masks. So it's a compromise getting these masks out. But back to the issue that you were raising, Tom, about would we deny service, and also who would enforce this? I personally would not want our drivers to have to do more than be offering masks. Also, what if the driver is tired of an N95 and for whatever reason, they put back a 3-ply mask on, and then the rider says, you're wearing a 3-ply mask and you're trying to make me wear a KN95, how's that going to go? Because the city employee policy says, you can wear almost any kind of mask. So those are some of the issues that I foresee if we mandate a certain type of mask.
Agreed.
Thank you.
That was actually my exact almost kind of question in regards to so it was a couple things, our drivers, they all have KN95 masks, I'm assuming, but maybe I shouldn't assume that just from what you just said.
Oh, sorry.
That's okay. Go ahead. Answer, because it'll make it shorter for what I'm going to say.
They have access to KF94, KN95, better ones than the ones we're giving out, and then N95s.
Okay.
And they've all been practicing and trying them all on. And at least maybe 2 of them drive with eyeglasses and have had the issue of eyeglasses fogging, and have even pulled their mask down under their noses to clear. And actually that is permitted, because if you can't wear a mask due to safety, you're allowed to take it off for a time, just like you're allowed to take it off for a time while you're eating. So as soon as I learned that it's okay if your eyeglasses are fogging up and you're trying to safely drive, you can pull your mask down and let it clear. Because we did have a rider who complained that a driver was not fully masked. So that's the state of driver masking.
So, so part of, me and 10 million other people who watch the news or read the CDC or follow this and follow that, all come up with some kind of different answer as to, what's safe and how long is safe and all that other thing. So my other piece of that question was 2, 1, are the drivers wearing the masks? And yes, they are mostly. How long are most of our rides for? Because that was a piece of the question where, if you are wearing that KN95, the study I saw just like this weekend had to do with, if everyone's wearing that, I could sit next to somebody with COVID for 24 hours and be fine as long as we're both wearing that KN95. I think our drives are generally under a half an hour, I'm guessing. So I'm just trying to think of the safety of the drivers as well as the people that are driving with them, but the time frame, that's kind of where how my question was as far as the masks.
I would say the longest ride would be to Springfield or Amherst. Those are not daily. And so you know how far that is from Easthampton. I would say certainly every rider on the van is a close contact of the driver and vice versa. But correct. And also, if it wasn't cold, they could open those windows and it would be equivalent to being outside. It's just that I'm pretty sure most of the time they're not opening the windows.
Louise?
One other question, looking a bit further along the line, I can foresee sort of like the antigens that masks, we haven't peaked for another month, maybe more. This is, or we can see the end, but we're not out of the woods yet of this one. Who knows what's next? And so my main concern is if we should start thinking about what precautions we're taking to stock up on masks before they become the new rapid antigen. Nobody can get them anywhere. And thinking ahead a bit.
Well, that's
again,
why oh, sorry.
No, it's okay, go on.
I was just going to say the health department just ordered a huge pile of masks. So at least staffing wise, we're fine, just so you know.
Just one other comment real quick, and we can wrap this up, is I'm a little reluctant with establishing policy that's not uniform with the entire city. I would hope that, I mean, so if, I guess the result could be that if I was going to get on the COA bus, I need one kind of mask. If I'm going to go into 50 Payson, I can use a different kind of mask. My mask, I'm going to go in and pay my tax bill and my mask is fine. I go get it on the bus and they say, sorry, that mask isn't good. I'm a little uncomfortable. You know, what if every department in the city starts establishing their own policy? You know, school department or police and fire or whomever. Again, I'm just a little reluctant having policy department by department when it comes to what type of mask you should wear.
Tom, it's
Yes.
recognized that 3/4 of the deaths from COVID so far are people over 65. I really do not see the equivalency between expecting the entire city to come along at all levels, all different kinds of jobs, from DPW to the schools is a separate thing. It's probably coming from their budget. I'm just going to say for the record, I don't think that stands up. And I think, if not totally, it's fairly widely acknowledged that COA is still kind of in the forefront within our community.
I don't disagree with that, Louise. And I know, I think some communities have established policies, you know, requiring vaccination, that kind of thing. And I'm okay with that if it's coming from the Board of Health, as opposed, you know, if Bree is saying, along with Louise and others, that we're going to establish certain policies for the COA, I'm fine with that. I guess where I was going with that is I'm not necessarily comfortable with this board in a vacuum creating policy like that, as opposed to it coming from conversations and policies, if you will, with Cindy and Bree and others that make those decisions within the city. We don't necessarily have the expertise in this group. We can establish policy that makes us feel comfortable, but we need policy that's going to pass muster with health folks, with legal folks, with those folks that are in charge on a daily basis in the municipal government. Hope that made sense. Stan.
It does make sense, and it takes me back to an earlier comment that was made about test kits, where it was said, you said that each family can get one test. Is that a kit of 2 tests or a single test? Because most recommendations are, if you are feeling that you may have symptoms, you should test twice. And that's per person in the household. So are we going to follow the wider guidelines or just stick with one test? Cindy?
Each kid has 2 tests.
Oh, okay.
And in this round, we're allowed to give out 1 box per household. Certainly if, say, 2 siblings who are really different households are living together, I'm going to give them 2 separate kits. If it's a family, I think I would rather give them a kit per person, but that's not the instruction. However, I know there is a hope from city government that we will be buying another round. Also, the federal government is supposed to be sending tests, and tests are supposed to be covered by insurance now. I know it's a supply issue, but this is the limitation that we're working with right now.
Okay.
Sorry to put in again, but Cindy, those tests are not available. I'll get into the ins and outs. I'm still trying to figure out what their reasoning is. They're not available if you're on Medicare.
Right.
I thought I heard they were.
No, Medicare, last I heard, I agree with, last I heard, Stan, was Medicare will not cover the cost of tests. And the issue about getting them for free, you need a prescription from your doctor. You can't just walk into Walmart and say, I want a free test because my insurance will pay. My understanding is you need a prescription.
In fact, I was just going to say one more, Cindy. I'd almost kind of like to see the COA, I haven't done it myself, getting to the bottom of this so that they can provide guidance, because it seems counterintuitive.
Right.
The Mass Councils on Aging is a great resource for issues around health insurance and public policy. And so, not that they can do anything, but in terms of interpreting and then advocating. So I'm trying to think of which legislator we should go to with this issue. I think we should research that, because at the very least we should make the complaint on behalf of residents, or at least get an understanding.
Is there a group, Cindy, that you're a part of that is a group of COAs in the area?
Yeah, that's the Western Mass cohort of the Mass Councils on Aging.
I mean, would it have a little more clout coming from that group to the legislators?
Yeah, and I mean, it's federal policy, not state policy. That's why I was just trying to think of, you know, maybe we could at least find the National Council on Aging is actually probably the place. And if any of you have an interest in this and want to go to the website of the N for National Council on Aging and take a look at what current advocacy work is possibly on this issue, that would be really helpful.
Okay, thank you.
Oh, this is, could I?
Yep.
One last thing about tests. Okay. PCR tests are better than rapid tests. If anybody has symptoms, the epidemiologist is encouraging people to stay home. You know, so the idea is if testing is limited, rapid testing or PCR testing, and you can't get it when you need it, or it takes too long to get the result back, or you can't find a rapid test. If you have symptoms, stay home. And many, many people are asymptomatic and may be carrying COVID and not know it. But thankfully, most people in our area are vaccinated and many, many people are boosted. So if we could, as a COA, communicate and share that information, if you have symptoms, stay home. And then the second part is that we're publicizing as much as possible where to get a PCR test. I can add that if for those people who can drive or have somebody drive to UMass, to Amherst to pick up a PCR test kit, you can do that in your car, you can do that in your home, and then you can drop it off in the receptacles, look up community testing at UMass. And there's an effort to hopefully spread that provision of those PCR tests so that you can do it basically remotely. It still needs to get to a UMass drop box or a drop box in the town of Amherst. But that is actually a way to get a, you know, good testing done if you miss the boat on the publicly available testing, or if they have to cancel it for some reason.
Great.
Okay.
Under old business, Cindy, you have the senior tax work off. That update's going to come next month.
Let me explain why.
Yep.
We could not, due to staff vacation, we could not meet with the proper staff person, Jen Gallant, in the time frame between meetings, but we are meeting with her and the auditor, JP, Joe, and I tomorrow. So great. We will move on this, and then whatever the next step is after learning more, discussing more, maybe we'll even get to take that next step before the next meeting. So that would be the time for an update.
Perfect. Thank you.
Welcome.
Okay, Stan.
Getting back to the testing for a second. A while back, I was in communication with Bree about the test kits that are evaluated at the Broad Institute in Cambridge. And she said that that's what they were using in the schools, and those are PCR tests. Does that mean that we have a number of those kinds of tests, and maybe we can expand on that for people who need PCR testing?
The PCR testing that I know of that's being done for the general public, including older people, is the testing they're doing outdoors, and that's all
Okay.
I know about.
Okay.
Joe?
Yeah.
Joe?
Yeah, just Stan, if the one thing about the PCR testing, where the results are analyzed by the Broad Institute, that's the testing being done at Holyoke Community College. That's where all those results go. So if somebody wants to go over there and get in line, then you can have a PCR test done and all your results will be sent to Broad. And apparently they'll give you the results back within, in my case, within a day. So it's quite efficient.
Yes, I know. No, I was just wondering because Bree had mentioned to me that the tests that she was doing are all going down to Broad for evaluation and reporting. So I was just a little confused. No problem.
Just a time check. It's 11:47 and I have IT coming at 12 sharp, but they can wait for me out there for a few minutes.
Okay, Cindy, with that, we're down to new business.
I don't think I put anything down, did I?
No.
And there wasn't anything coming from the board. So Crystal asked how could she be helpful, because I had mentioned that we could use her expertise in a few areas. And then I realized we could just make that discussion new business if we had time. And at least I could voice what are the things I was thinking Crystal could choose from to help with, and perhaps others might be interested as well. Is that something people would want to hear about, or I should just talk to Crystal individually about?
I think we've got 10 minutes.
I'd be interested.
Okay. All right. So what I've learned about our outreach services is that we say in different places what we offer, or we don't say that much. We have SHINE certified outreach workers, so they provide health insurance advice, but they actually don't provide the service, which is when you do a mass health application, you provide follow-up and receive documentation in the mail and perform the case management you need to do to take it to the plate. Brendan Rogers used to do that. So we do still get some mail when people apply for Mass Health. We also have a number of other benefits that are on the table for older people, and we don't necessarily provide benefits counseling and application assistance for all of them. All the different types of benefits, and we may not be up to date on all of them. So mostly we do fuel assistance and SHINE. Are the other agencies in the community that provide help with accessing food stamps and other services taking care of that need? We don't know. So I was going to ask Crystal, could we take a little bit of a deep dive into what should we be able to do given the staff hours and level of staffing that we have? And how do we assess if we're being productive in that area? How do we assess, is there more we could do? Are we doing the right amount of outreach? If Highland Valley, as Pat mentioned, is understaffed sometimes due to COVID. You know, are they struggling to get these benefits needs met? So that was one area. Another area is, as I mentioned before, that it's good to take a look at transportation in terms of the fiscal area. Well, it's also good to look at transportation in terms of the actual operations and the services that we're offering. And are we doing that in a way that is good for Easthampton, but also reasonable for the COA? So that's another area to explore. I think there was probably one other area that I'm not thinking of right now. And then another area that I may not have mentioned to Crystal, but would be good to work on. I'm not sure if we can work on it just within the staff or if we might need some additional help. But the volunteer aspect of the Council on Aging has been so interrupted by the pandemic that it impacts many of our services. And at the same time, it's an opportunity to rethink how we offer volunteer opportunities and use volunteers. And we don't have a volunteer coordinator. So thinking through that aspect of the COA is something that I think we could work on kind of at a higher level. So those are some of the things that I'm thinking about that I wish I had more time to work on, but you know, kind of takes a village. So there might be some role for the COA board members in either doing some research, being a sounding board, you know, creating a subcommittee. That's it.
Yeah. One small thing that I wanted to sort of get it out there is what was EBB, and I've lost track. I don't know the new one, but there is means tested financial assistance for internet. It's now becoming more or less permanent. And can we even do something like put an article in the newsletter? I should say as an aside, I haven't seen the newsletter for a very long time. I keep trying to get on the mailing list, and that's a separate issue. So I don't know what it has right now, but yeah.
There was recently an article in the paper that I saw about this, and it was very confusing to me. It sounded as though people who are already getting that benefit could be extended into March, and that if you wanted to join, even though the government was just putting this out there, it almost seemed like it was backdated from mid-December, but we just got a hold of it in January, and the deadline was almost immediate to apply. And part of the benefit is, like, say, if you buy a laptop, $100 off on your laptop, or if you buy a phone, $50 off on your phone. And then there's the help with accessing the internet. So I don't know enough about it to know, is it even worth going into the March newsletter, because will it be inaccessible by then? But we can do that research.
Ann?
I also saw this week that the Williston Library is offering their patrons the ability to borrow from the library a hotspot with data access. Is that a program that we should look into getting involved with, to be able to provide that to seniors as opposed to anyone?
There's a Highland Valley grant using Title III federal funds that Northampton applied for and received for regional councils on aging in the region to work together on technology. And I'm still learning what the funds can be used for and whether their original plan can be modified based on who's interested in using it. It seems that it can. I don't know if it would cover that, Stan, but I can ask.
Yeah, I mean, it might be simply a good stopgap measure if somebody, lost their internet connectivity for a short time, they could borrow one from us and restore it until theirs was repaired.
I would say, especially say somebody has a court date and they don't have any access. What we've been doing is we've been running that court date through Zoom on our computer and conference calling in that resident, which is awkward, but it can be done. And there's only one, I think, person that we've done that for. We could, but it's complicated enough that I'm not sure we should advertise that, that we can do that for everyone based on staffing. But in terms of buying some hotspots to lend out, we could talk to the library, find out what that cost. I know that when we had tablets that we could loan out, it was an awkward program and not well used because people didn't really know how to use them, or they didn't have the internet, or it didn't serve them well because it was so brief. The ones the library has are a 2-week loan.
Yep.
So
Wait,
Cindy,
Stan, did you mean Wilson as in the school or Wilson
No,
Library?
our library.
Right. Okay, those are only for 2 weeks.
Right.
So they're.
So Cindy, you identified 3 areas, I believe, that you could potentially use Crystal's expertise to sort of do this 30,000-foot view analysis. That's at least if I heard that correctly.
I would say, and Crystal, you could chime in, but I would say certainly outreach. I don't know about transportation, but I know Crystal has a lot of experience with outreach, and we call it outreach here. They're not doing publicity. They're not recruiting clients. They're doing benefits counseling and application assistance, just to be clear.
So just before you jump in, Crystal, I guess my suggestion was going to be, Cindy, that, and maybe you just answered that, is we focus on one of those issues and have Crystal's expertise. If she needs additional assistance from other board members, we could definitely do that. But my suggestion was going to be that we focus on one, and maybe that's the one that we would do. Crystal, go ahead.
Yeah, I'm happy to assist your outreach workers with public benefit analysis and application assistance based on what you feel the need is coming from the community, as well as volunteer recruitment. So I'm happy to help with that.
That's great. That's great. And keep in mind, if we pick 1 or 2 of these, we're already doing another one right now, which is senior tax work off, everybody. So we do have members involved on multiple issues, but if there's a member who isn't involved in any special side work and wants to be, then let me know, because we could kind of spread this out. So if we started with outreach and we know Joe is working on senior tax work off along with JP and me, I know Louise and Stan, you had offered to help with senior tax work off, and I'm sure there's going to be more work in the future. It's just right now, just in terms of the fiscal implication, we're good with the number of people. Then upcoming is there's no word on renovating a new space yet. Nothing, no lease finalized, but when that is finalized, we'll need people to work on that as well.
And Cindy, my involvement with the senior tax work-off with Joe was simply, I shouldn't say simply, it was pretty interesting, but the interview process. And I'm happy to continue with that if need be. If it's just you and Joe, that's okay too. But if you need me when we recruit new applicants, I'm definitely happy to be involved, continue to be involved with the interview process.
That's wonderful. Thank you so much. I mean, I think the senior tax work-off is big enough that almost everybody could take a piece at some point of the process.
Stan?
Before we break, I was wondering if there was any update, Cindy, about our potential future home down the block.
Oh, as I just vaguely referred to. The last I heard, as of Friday, the lease was still being negotiated with CHD.
Yeah, that's going to be a long process, I believe, and it'll be interesting. But a lot going on behind the scenes with that, I think, Stan. Yep. Okay. I have 12 straight up, Cindy.
Yeah, I just wanted to say thank you so much, Crystal, for applying to be a council member, and to let everyone know that we have one other slot, and that if Pat does end up resigning, we would have 2 more slots. And we all said to each other that we should all be looking out for the council to be a fully membered board. So
Right.
Yeah,
Definitely. I believe our total, our number, Cindy, is 9, if I'm not mistaken.
I thought Barbara said 8, because I thought she said there was only 1 slot left if Pat was still on board. So maybe we could clear that up.
I think we have 8 now with Crystal. 1, 2, 3. I'm counting faces on the screen.
Well,
1,
we
2,
don't want to
3.
count Mary.
No. Stan, Tom, Joe, Crystal, Pat, Louise, and Chuck. You're right. That's 7. Did I count right?
Yeah.
Oh, I didn't.
So Barbara did say 8, but are you counting Patricia in 8?
No, I didn't. I think I didn't count myself in that group. 1, 2, 3, 4, 5, 6, 7. We have 8 now with Crystal. We have 8 now with Crystal. And typically, Cindy, boards are made up of an uneven number.
There you go.
So I'm guessing it's 9.
That's it. So we have 1 slot left,
right.
and we're going to find out about Patricia.
Right. Joe, you're gonna try to get in touch with Pat, Joe?
Yeah, my intention was to send Patricia an email and CC both you and Cindy on that.
Perfect.
And basically just find out. And Tom, you're aware that what our the bylaws that we discussed this thing, right? In terms of there being an attendance requirement.
Mm-hmm.
Yeah. Presumably the bylaws say 3 and out, I believe. If you miss 3 meetings, well, I shouldn't say 3. If you miss 3 meetings, you could be removed from the board. Obviously, there are people sometimes with extenuating circumstances, but if you miss 3 meetings, you could be removed from the group. But I'm more concerned in Pat's case that it's some other issue that's having her away from this for now.
Or at least, yeah, getting some word from her about, having to be away for a while or something.
Exactly. So thanks for doing that email, Joe.
All right.
If there's nothing else right now, we're at 12.
Sorry.
Louise?
Joe, contact me. I think I have a friend of a Lincoln if you don't hear from her.
Okay. I mean, I'll send email first and we'll let you know.
Just it. Good. Okay. Sorry, go ahead.
Could I have a motion to adjourn?
So moved.
Stan and Pat seconded. You realize if we don't get a motion to adjourn, we just keep meeting. So
perpetual meeting.
All in favor of adjourning, say aye. Anyone
Aye.
opposed to adjourning? Thank you all very much. Thank you again, Crystal, very much. Thank you.
Thanks,
everybody.
Tom.
Next
Thanks,
meeting,
Louise.
February 15th, next meeting.
Yeah.
I won't be here for that. I won't be here for that one, but we'll talk later.
You can zoom in from anywhere, Pat. I'm just kidding. Just kidding.
Could, but
just kidding. Thank you all very much.
Later. Bye.
Bye. Louise, thank you for doing
Bye.
the minutes, and we'll connect about making sure we get all the minutes on the website. Okay.
Thanks, everybody.
Bye.
Bye-bye.
This government meeting is brought to you by Eastworks and our local cable subscribers.